Thank you. It's really pleasure to be here. I think I give a bit different perspective for the earlier talks because, for instance, you have talked about this optimizing your health and on the wellness side, and I have spent my professional life treating kids with severe diseases, and basically most of them are not sick because of their lifestyle issues, but they just get sick, and even sometimes they may die to severe diseases. And in there, we also believe that with new digital technology and specifically with advanced analytics, we can do great things. Which one is forward in here? Thank you. There are 3 choices in here, so. Oh, this one, this big one. Sorry. Okay, so I just show you some examples we have been doing and what we are planning to do next. This is from our neonatal unit where we have worked together with our neonatologist and IBM and our own data scientist. And basically what we tried to do was to predict severe bacterial infection in these preterm, very, very small, really these small babies, because that disease comes on board very, very rapidly and is life-threatening when it comes. So we want to know much more before when it will come. So challenge was to make Dr. Watson to predict 24 hours before that this baby is at risk. And now, after 1 year work, we have been able to predict this in 93% accuracy. So if this works also in a real life setting, this will be a major breakthrough in preventing those severe and especially treat those very severe infections early enough. And we have here some more results in there. I just show these because I think this is fun, because these are now from the old data, from our data repository. And basically those are not real names. If all the Finns can recognize the names, they are all the characters from the Unknown Soldier novel. So most likely those soldiers had some holiday between their fights because they have so many babies. Anyway, this will be something which our neonatologists will in the future look at when they are on their ward. They can see if the risk is increasing or decreasing or how the baby is doing, and if everything goes red, then they know that they have to be very, very careful and be ready to start the antibiotics off the bat when any kind of real symptoms come up. So this is basically the way we work. I think once you start to use big data and advanced analytics and machine learning, as Minna said, you got to have lots of data, and it must be quality data. And that was one thing we had with these patients. And then you got to have a clinically relevant challenge, because the doctors, and I think it's not ethical to do it with some to play with the data. So we got the life-threatening disease to be prevented. And then maybe the most important thing is that the clinical researchers and doctors must be excited about this kind of possibility. And when we started this less than a year ago, our Sture Andersson, who is leading this project, professor of neonatology, he wasn't that excited, but after the first round of results, he started to get excited. And now he's very excited, and basically what we are now trying to do is that we start some more pilots. We are doing a pilot already with fetal heart monitoring, and this is more like a preventing medicine, that baby is still in the womb and you follow the heart rate and you try to predict better than today if some problems are coming. And then we have some other things which we are just starting now with other companies. Real-life translation in a patient caregiver setting. And just yesterday we got to talk about imaging of diagnosing and in intracranial bleeding in imaging. And I think those kind of meetings, they are very preventive for me, because I'm in the age where you have to be cautious about evolving dementia already. And yesterday we were talking with Nokia's best brains. There were plan makeup people, our neurosurgeons, our data scientists, and then I was able to be in the table to talk and plan our study and trial, and I could feel like the blood was flushing around my brain. It was so intellectually rewarding. So this is not only important, this is also fun. So that's one of the reasons I'm involved in these kind of pilots. And what we would like to now learn. We have now these e-health services for mental health, for people with weight problems and 10 other disease groups, which means that we collect a lot of data, not only to our electronic healthcare records, but also from these patients and from the net. So that's one important reason we want to learn how to use the big data analytics, because we will have that kind of big data. And if we want to be competitive, we have to be able to utilize that data. And in that kind of work, you basically, I think, divide the system. This is by Clayton Christensen. I think this is a good way to divide the development of these kind of innovations, that there is this steady sustaining progression in the background, like a new precision drug, for instance, to the cancer, which changes the treatment of the cancer completely, but it's still done in a way we are used to do in a big corporation. But then when you start to use these kind of maybe not that high quality, but easily scalable, expandable things and develop them. A typical example is this doctor chat, which really seem to be disrupting the work of even the specialist doctors. Then this kind of thing is very difficult to do in a big corporation. You have to be able to create some kind of autonomic bubbles inside organizations. And then, of course, what's even more important, you have to work together with the companies and all sizes of companies, the big ones, but also with the small ones and startups. And this is something we need help, because we don't know yet how to do it right. But anyway, I think the change is fast and it's continuous and it's in everywhere. So basically, whatever fixed organizational model we create, it will fail. This is something I try to tell when we are speaking about these SOTE issues, that don't try to do a perfect solution and nail it in the place, because it won't be right anyway. These things are changing so rapidly all the time. So this is, I think, how we should work. We have to be there where we have the patients or our customers. We have to all the time work with people who are actually have the substance skills, whether it's a neurosurgeon or psychotherapist or nurse on some topic. But without that knowledge, only with technology, we can't really do big innovations for our country. And then you have to have these technical skills and analytical skills and of course, service design skills. And once you put all those things together, then you start to see good results. We have seen already with our first pilots, for instance, with AE, that still Thomas Edison is right. Innovation is 1% inspiration and 99% perspiration, and that perspiration must come from the working together. These people from IBM, from our IT department and our clinicians, they have sat now together almost a year in the same room almost on daily basis. So it takes time, but that's the only way to really get good results. Thank you.